Well, good afternoon to everyone joining us today. Welcome to our webinar, Improving Rare Disease Care in Ukraine, Access to European Reference Networks and Expert Resources. We are truly honored to have such a diverse and dedicated audience with us today. On behalf of the organizing team, it is my great pleasure to extend a warm welcome to all of our distinguished speakers and panelists. Experts in rare disease care, clinical networks, and cross-border collaboration, whose availability and willingness in sharing their time and insights makes this event possible. We are grateful for your partnership and for the deep experience you bring to this important discussion. I would also like to warmly thank all attendees who have taken the time out of their busy schedules, especially in what we understand to be extremely challenging conditions to participate in this webinar. Your interest reflects a shared commitment to advancing health equity, knowledge exchange, and practical solutions for clinicians and patients alike, especially those who are navigating extraordinary challenging circumstances. This webinar brings together two European reference networks, Endo-ERN and ERN-eUROGEN, to support healthcare professionals and patient advocates in Ukraine by exploring how access to ERNs and associated expert resources can strengthen care for individuals living with rare diseases. Today's discussions will introduce the ERN system, highlight ways that Ukrainian clinicians and patient representatives can engage with these networks, and provide practical insights on tools like the clinical practice management system that facilitate cross-border clinical collaboration. We convene at a time when the situation in Ukraine remains deeply concerning. The war has not only caused immense human suffering and widespread displacement, but it has also put significant strain on healthcare systems and the delivery of specialist services. In the face of these realities, initiatives like this webinar are more than academic exercises. They are expressions of solidarity, support, and shared responsibility. A key objective during the current funding period for all ERNs is to support Ukrainian competent authorities and healthcare units by sharing best practice and realizing virtual consultation with CPMS. By connecting Ukrainian clinicians with the broader European network of expertise and resources, we aim to help ensure that rare disease patients who already face unique challenges are not overlooked amidst the broader crisis. This gathering underscores a powerful truth. Healthcare knows no borders, and collaboration in clinical care and knowledge sharing, when harnessed, can make a tangible difference in people's lives. We hope this webinar will spark not only understanding, but also meaningful partnerships, actionable insights, and renewed commitment to supporting rare disease care during times of crisis and beyond. Before we begin, I encourage everyone participating today to engage actively, ask questions, share perspectives, and take advantage of the opportunity to connect with expert voices and peers from across disciplines. Thank you again for being with us today, for your dedication to rare disease care, and for standing together in support of clinicians and patients in Ukraine. With that, let me now hand over the program to the first speaker. Thank you.
Yes, thank you, Charlotte, for that really powerful introduction. I'm Michelle Battye, and I'm the manager of the European and Reference Network that we call EUROGEN. And I'm just going to share my slides now. So I'm going to give you a brief overview of the history of the European networks, just very briefly. So what are the European reference networks? So European reference networks are networks of healthcare providers that are across the EU, and they're all focused on rare and complex diseases. And they were established by the European Commission to improve diagnosis, treatment, and knowledge sharing. And they're really aimed at addressing the problem of rare diseases affecting a very small percentage of people. And really, it's the medical expertise that is scarce and rare in these cases. And European reference networks are really designed to ensure all the expertise, resources, and knowledge that are created by the various clinical experts working together are shared across border. And thanks to the European Commission funding support, all the resources created by the ERNs are free. And what has happened since the beginning of the ERNs in 2017 is I don't think anybody really foresaw the incredible amount of active collaboration that's happening across the ERNs. And that's something that's really quite new and exciting. And there's constant collaboration between the clinicians, researchers, and patient organisations across the ERNs. Patients are at the heart of everything that the ERNs do. So the first 24 ERNs were launched in March 2017, and they involved more than 900 highly specialised healthcare units from 300 hospitals. And there was already a process of enlargement of the ERNs in 2022 when another 620 new members joined. So as a result of this now, I think we're up to over 1,600 healthcare units and across the whole of the EU and Norway. So you can see there really was a very positive response for the call that happened in 2022. And that also facilitated the geographical expansion of the ERNs because now all member states and Norway are covered. There are 24 of these networks, and each of them has a coordinator who is a scientific world opinion leader in their field. And then all 24 of these coordinators collaborate together in one group called the Coordinators Group. And that is the official group which collaborates with European Commission and DG Sante. And we're always very, very happy about the support that we receive from the European Commission and their grant funding authorities. Actually, I must say, Hadia, without their support, we wouldn't be able to do what we do for our patients. All ERNs actually are structured in the same way and have 7 mandatory work packages. And at the heart of what the ERNs do are using CPMS, the registry's training, education and clinical practice guidelines. More will be said about this later, so I won't go into those now. And there are also 2 optional work packages in the ERN grants, which relate to the Ukraine. And they're really about capacity building and sharing best practices. So we'll show you later on in the presentations how our 2 ERNs, EUROGEN and Endo-ERN, both collaborate with Ukrainian clinicians. And we very much hope to stimulate more collaboration, so please do bear that in mind. We were really delighted to see the European Commission's very strong support for both the Ukraine and the ERNs. And this really culminated in a legal agreement, which I have to say was conducted very swiftly and efficiently indeed. To allow the ERNs to use CPMS, the Clinical Patient Management System, to be used by Ukrainian clinicians. And we've had some examples of that happening already, and we'll share those with you later on. When the war was first started, the ERN coordinators acted together, issued a statement of support, and launched a website in solidarity with Ukrainian clinicians, really hoping to reach out and reach those doctors who were treating patients with rare diseases so that we could offer whatever help and support we could. Some coordinators even facilitated the transfer of specific patients and children with these rare diseases who needed really urgent treatment to their healthcare providers in the EU. So there was quite a remarkable response, I have to say. And of course, we mentioned the cross-border case discussions. So those are some ways that we can provide support for the Ukraine. And I will stop here now and invite Professor Alberto Pereira to join me in the webinar environment. And next, we are going to do a spotlight on our two different ERNs. So mine is ERN-eUROGEN and Alberto's is Endo-ERN. Unfortunately, my coordinator couldn't be here today, Professor Peter Mulders, so I'll give the presentation on his behalf. But Alberto, I'll stop talking now, and I'm delighted to give you the floor.
Thank you very much, Michelle. I'm also delighted and privileged here to be here with you. So this is what the ERNs are all about. So thank you for the kind introduction, Michelle, and the clear overview of what ERNs are. So this is a print screen of the website of Endo-ERN that shows that Endo-ERN is a network that promotes the diagnosis and treatment for patients with rare endocrine conditions. And as Michelle said, we started in 2017. The network was expanding after the second call in 2022, and the current EU funding continues until the end of 2027. So Endo-ERN, we say that we provide expert multidisciplinary care throughout life, so from birth to senescence and from cradle to grave. You see here some specific themes, but there's a strong focus on transitional care and puberty. Endo-ERN for now is the largest ERN. We are privileged that we have full EU coverage. As we say, we cover both pediatric and adult expertise, and the patient representation is included in the governance structure. The European patient representations are called ePAGs, the abbreviation which stands for European Patient Advocacy Group Representative. The European landscape for rare endocrine condition is divided into so-called main thematic disease groups, MTGs, that range from adrenal, disorders of calcium and phosphate homeostasis, genetic disorders of glucose and insulin, genetic endocrine tumor syndromes, growth and genetic obesity syndromes, hypothalamic and pituitary conditions, sex development and maturation, and thyroid. And the number within the pie charts reflect the number of healthcare providers that have been endorsed specifically at a national and European level for specific expertise in these specific MTGs. So despite the fact that we have more than 100 healthcare providers, these healthcare providers, they do not need to overarch all the expertise available within the network. As you can see here, between 40 and 60 healthcare providers are represented within each of the different main thematic disease groups. The enlargement of disease areas for the ERNs are bound to a new EU call, and for the healthcare providers themselves, we have a protocoled enlargement standard operational procedure that you can apply for depending on the disease area that you would like to be endorsed for. This is the structure and governance of the ERN. As you heard from Michelle Battye, the work package 1 to 9 are more or less the same in all the ERNs. And you see here that the work package activities, they transversally go throughout all the main thematic disease groups. All the MTGs are chaired both by a pediatric endocrine expert, an adult endocrine expert, and a patient representative. So these are the Endo-ERN key deliverables. So first of all, to demonstrate the added value of virtual multidisciplinary expert boards, for which we use the clinical patient management system, the unique telemedicine tool that is the only one globally that is GDPR approved. Second, the standardization of care for patients with our rare conditions using transparency, using guideline development, and using patient involvement. And last but not least, to demonstrate structural pathways into science. The ultimate mission is to reduce present health inequalities in Europe. And having said that, again, it is a big privilege to have Ukrainian colleagues here on board, and we definitely reach out to you. We will overcome as professionals any political barriers, and we are here for you. So in brief, the telemedicine tool, clinical patient management system, allows virtual consultations. So in principle, patients have the right to seek the medical expertise and the healthcare provider wherever in the EU he or she is located, but the virtual consultation allows that the vast majority of the patients can get a good diagnostic or therapeutic advice without the necessity for cross-border traveling. The second is the training and education using the ERN Academy program. Third, the clinical practice guidelines and the clinical decision support tools that will help to standardize care practices and also to reassess adherence to the new guidelines and the decision support tools every 3 years. And last but not least, the platform that enables to link care to relevant research questions, and that is the platform of the European registries. Endo-ERN in this respect uses the same platform as the ERN for rare bone diseases, and the EUREP, so the European Registries for Rare Endocrine and Bone Conditions, serves both Endo-ERN and ERN bond. One of the attractive features implemented also under the umbrella of the ERN Academy is a clinical exchange program, which allows young clinicians and young researchers to be hosted in one of the ERN centers and to absorb any new innovative aspects of care practices for any of the rare conditions that are treated for. So last year, the European Commission issued the ERN success stories glossy from each of the ERN includes a collection of what we have done so far within the key deliverables. So how many guidelines and care practices have been developed, how many training and education activities have been developed, how many patients have been discussed within the clinical patient management system, and how many patients have been entered within the ERN registries. So so far, it is really a very successful story, but again, the proof is in the pudding. So the incentive for patients and healthcare providers in countries with less resources is, of course, much greater. And again, we are here for you. So if you would like to find out more, please link yourself to our socials. And this is also the QR code, which you can find our homepage, which is a very nice interactive platform. And again, for any other questions, we are here for you. And having said that, I would like to conclude my presentation again by A warm welcome to all of the Ukrainian colleagues, and please make use of this system because this system was designed especially for countries and conditions like yours. Thank you very much.
Thank you very much, Alberto, for that lovely, very clear and comprehensive introduction to Endo-ERN. I will now try to do the same thing for EUROGEN. Hello, I'm Michelle Battye and I'm the manager of ERN-eUROGEN. Thank you very much for giving me this opportunity to introduce how urologists, surgeons, clinicians, researchers and patients can all benefit from the resources of ERN-eUROGEN. Just to explain now a little bit about what is EUROGEN. So EUROGEN is one of the European reference networks, and it's the one dedicated to rare urorectogenital diseases and complex conditions, which are often low in prevalence but very high in complexity, and they all require highly specialised surgery as a treatment. We aim to improve care across Europe by sharing experience, developing standards, and supporting clinicians and patients through a range of activities. Our strength lies not only in our size, but also in how we collaborate. And EUROGEN includes both full members and affiliated partners. We work closely with patient organisations, and we're really proud to have a European Patient Advocacy Group, or ePAGs, and they're included in all of our activities and our governance structure. We also benefit from strong collaborations with supporting partners. And importantly, we don't work in isolation, we collaborate with other ERNs, as this event today demonstrates. EU health bodies we also collaborate with, and global initiatives to make sure that all the knowledge, research and best practices can be shared actively across the network and even wider for the benefits of all our patients living with rare urorectogenital diseases and conditions. Currently, the EUROGEN network includes 56 healthcare providers across 20 EU member states. And these expert centres are currently organised into 3 work streams covering more than 20 sub-thematic areas of rare or complex urorectogenital diseases and conditions. Work stream 1 focuses on rare congenital anomalies in paediatric patients. Work stream 2 addresses functional conditions that require highly specialised surgery in adults. And work stream 3 is urogenital tumours. I won't say too much about the clinical patient management system here because other colleagues are going to go into it in more depth. Suffice it to say that this is the secure system, and I do stress that it is secure. All your medical information is perfectly safe as a patient, but it enables us to do the cross-border healthcare discussions and give advice to clinicians who might need some advice on how to treat a particularly complex patient. We also have a registry, and the idea is that we can deliver better outcomes from shared data. We know that this is one of the major issues with rare diseases, scattered and fragmented data. And the idea is if we can bring all this data together in European-wide registries, we can track the long-term outcome for patients, identify gaps, and this is also an incredible resource which we use to support guideline development and future research. Our particular EUROGEN registry is open to any healthcare provider in the EU that would like to join it, provided you are willing to deal with all the local, legal, ethical and data protection issues. But please do get in touch if it's something that you're interested in. If your hospital would like to join, you are more than welcome to do so. So, training and education, this is another key cornerstone of the ERN activities. We are here to support lifelong learning. It's all free resources. Some of the webinars that the ERNs run receive really excellent feedback. So, I would encourage you to seek those out on the website and have a look at some of them. In EUROGEN, our webinars are available via our YouTube channel. And we have also published a book. Elsevier published it on rare and complex urology. And that's the latest collective scientific evidence-based knowledge of the network. So it's a really great resource. And we will be writing more books in the future on specific topics within our ERN. We also produce guidelines and patient resources, and on the slide there is an example of some of them. So again, if you're interested in a particular area, look around the ERN websites. There's a huge amount of completely trustworthy evidence-based resources. And in terms of supporting the Ukraine, well, we like to think of it as solidarity in action. We do what we the best we possibly can online. So we are all here to provide Ukrainian clinicians with access to CPMS for virtual case discussions. So we really would spread the word as far as you can across the Ukraine. We would be delighted to have contact from you. So please do bear that in mind. And any questions that you have, come back to us at the end of the webinar. In EUROGEN, we have developed a specific webinar program in collaboration with the Kulmanetsky Children's Hospital. We hold regular virtual meetings with them as we have been supporting them really around patients with spina bifida. And we had an EC-wide ERN campaign to try and raise awareness about the fact that we exist. We're here to help. And together we want to make sure that no Ukrainian patients with rare diseases are left behind. So please feel free to contact us, and I hope that's given you a quick overview of EUROGEN as one of the ERNs and what we can do to try and help the Ukraine. Thank you. The next talk in the agenda was actually, I can introduce him. It's a very dear colleague of ours from the European Commission. We're absolutely delighted to have him with us here today. And he's going to explain a little bit about how the European Commission facilitated all this fantastic collaboration with Ukrainian clinicians and how the process should work. So, Yal, thank you so much for being here with us today, and I will give you the floor.
Thank you, Michelle. Thank you very much, and good afternoon to all the audience. I'm delighted to see that we have more than 60 persons today. For the European Commission, this is a dream coming true, because in all our previous webinars with the Ukrainian colleagues, we had 10, 12 persons, not more. So having a large audience is really nice for us today. My name is João de Souza. I work for the European Commission, as Michelle explained to you. And my role in the ERN team is to coordinate all the developments around the CPMS, the IT platform that you can use to discuss complex cases. So the European Commission went to quite a great trouble of discussing this with Ukrainian authorities to reach an agreement that would allow you to use this system. The difficulties were simply because for the time being, Ukraine is not bound by the GDPR, so the legislation on data privacy. and we had to take some particular precautions so that patients can feel that their data is protected even when it is being discussed by clinicians from abroad. That was our concern, that Ukrainian patients feel perfectly comfortable about their data being shared, and being aware that the data is only shared on a need-to-know basis. So only the clinicians that need to give you an advice will have access to the data of your patients. So that was the reason for establishing this agreement between the European Commission and the Ukrainian Ministry of Health. One of the practical consequences of this agreement is that you are most welcome to discuss and to reach ERNs whenever you want and as frequent as you want. The only restriction that you must be well aware is that when after your preliminary discussions with your ERN, when you decide that your case is indeed to be discussed in the CPMS, then you should contact what we call the Ukrainian hub, Okhmadit Children's Hospital in Kyiv, that is responsible for centralizing everything that is related to data privacy. So the patient you will need to ask your patient the consent for their data to be shared with the doctors. So they have to sign a written consent. This consent is a document that is written in Ukrainian and in English. So exactly the same text in both languages for patients to be perfectly aware of what they are signing. Patients sign on the Ukrainian side, and this consent should be sent to the Ukrainian hub so that they can archive the consent, see if it is well written, well signed, archived, and then they will initiate the process of granting you access to the CPMS. So this is the only restriction that you need to respect, is no case can start being discussed in the platform without first involving the Ukrainian hub that will do the checking on the data privacy constraints. Apart from this, you are free to discuss to discuss with each ERN as far as you need in order to either receive the help to reach a diagnosis or receive advice on a given treatment. So this is indeed exactly the same way as any hospital in the European Union works, except this first part of the consent, that in Europe, each hospital is responsible for managing the consent, while in Ukraine, this is not applicable to Ukraine. So that's why we need to have this first step of the process involving a single hospital, which is in this case the Ukrainian hub in Kyiv, to guarantee that if in the future we may have an audit, for example, from the data privacy authorities of the Commission, we know where to search the data, and it's not scattered over numerous Ukrainian hospitals. It's everything centralized in a single hospital. For the rest, you will use the system exactly as any other European hospital uses the system. All the features are available to you. I'm pretty sure that the ERNs to which you corroborate will be more than happy to explain you the details of the system. And ourselves, we also have trainings. Ourselves, I mean the Commission, we also have trainings to explain you the particularities of the system. These trainings are held once per month. All ERNs have the calendar, so they can give you the next trainings. The trainings are also recorded, so you can also access a recorded version of the training in case the schedule is not convenient for you. And I can also say that one of the trainings is already subtitled in Ukrainian. So at least one of the videos is already subtitled in Ukrainian. And we are in the process of also translating other videos to Ukrainian using subtitles. So you can, if you are not so comfortable with English, if that is the case, you have this version with Ukrainian subtitles. So in a nutshell, it's what we prepared for you. And of course, we can only be happy if you use the system. So far, the usage has not been great, not much. Some cases already recorded in our records, but not much. So feel free to use the system and discuss the cases that you need with with the selected ERNs. Michelle, thank you very much. If there are questions, I'll be glad to answer them, and I give the floor back to you.
Thank you very much, yeah. And so next on the agenda, we're going to dive a little bit deeper now into the clinical patient management system so that we can really explain how that works to you and hopefully encourage Ukrainian clinicians out there to contact us and use it. And we have Greta Ginsky, and she dedicates her role to the CPMS Help Desk Manager. So Greta, thank you so much for presenting here with us today.
Good afternoon, everyone. My name is Greta Ginsky, and I'm working on the CPMS Operational Help Desk for Endo-ERN. And I'm here to walk you through the practical steps of how to access and use CPMS. So the process involves a few steps to get started, but once you're set up, the system makes it quite straightforward to get expert opinions on your patients. So let's start with the first question of how do I get access to CPMS? As already mentioned, the process is handled via the Ukrainian hub. So once you're authorized to proceed by the Ukrainian hub, you can request an ERN guest account to CPMS. What you will need for this is an EU-login account. And if you do not already have one, you will need to create one and set up the two-factor authentication with the EU-login app. So I will not go into detail here, but we have a very detailed manuals and guides on how to do this, and you can always reach out to us if you get stuck with this. Once that's done, you can use your EU login details to log into CPMS and make a request to the relevant ERN to grant your guest access into to the system. Once your account request has been authorized by the ERN, you can go, you can log into CPMS with your EU login details and complete your user profile, so providing information such as your hospital you're working at and your role. And you are then able to enroll the patient case in the system and build your case by uploading all the relevant information that the consulting experts will need to make their assessment. After enrolling your case, you can use the chat function within CPMS to contact the person assigned by the ERN, and you and the contact person will then agree on how to proceed with the discussion of your patient case. When the discussion is complete and the ERN decides to close the case, an outcome document is automatically generated, and this report summarizes all the relevant advice and the names of the participating experts. And you can download it directly from the system, so you have documented record to refer back to in your clinical work. One important thing to note is that once the case is closed and the outcome report is generated, the ERN will delete your guest account from the system. Now I want to go through the process of submitting your case to CPMS and how it just looks like in practice. So before you enroll your patient in CPMS, you need to make sure that you have collected patient's informed consent. So the first thing the system will ask you to is to confirm that consent was given. And next you will provide the basic identifying information, so the patient's name, date of birth, sex, and nationality. However, this information will not be visible to other experts in the system, and instead CPMS will automatically generate a nickname for the patient, which you can also change if you would prefer. But this nickname is how the patient will be referred to by others in all discussions, so other users will never see the patient's real name, only the nickname. You will also need to add information about your center and assign the name of the lead clinician, so the person in charge of the case. And next, you need to specify which disease area the case relates to. So you need to select one from the list, which depends on the respective ERN. And you can also choose a subthematic area to be more specific, though this is optional. And this information is important because it allows us to find the right experts to invite to your case. Once the patient is enrolled, you will need to open a discussion. So at the top, you write a short case description. This can just be a brief summary of the questions you have, what advice you're seeking regarding treatment or diagnosis. And once the discussion is open, the invited experts can write messages. They can share advice already or ask for clarifying questions, and you can also respond to them, of course. So it functions basically like a chat. CPMS is quite flexible about what files you can upload, supports DICOM format as well as zip files. If you have multiple images, for example, you can upload pathology reports, lab results, or imaging, even videos. Some users include a PowerPoint, for example, with a brief summary of their case presentation. But you can essentially upload any relevant information that is needed by other clinicians to make a good assessment and give valuable feedback. One important thing is to pay attention to is that the file should not contain any identifying information, because this will be visible to all invited users. So please make sure that you've anonymized all your documents before uploading them. Once the case is enrolled and the documents are uploaded, the discussion is opened. You can already start to receive advice on your case via the discussion section. However, you have also the option to arrange a virtual consultation, which can take place within CPMS as well. And this is usually organized through the operational help desk. So as the case lead, you have the choice. You can simply receive advice from the invited experts via the discussion page, or you can ask for a live video discussion at the help desk. And if you opt for a meeting, we will find a time that suits you and as many of the experts as possible. Many ERNs also have regular meeting slots in which a couple of cases are discussed together. And this typically allows more experts to attend since it's scheduled just further in advance. But for more urgent cases, for example, we would always try to find the next possible date. So you can always indicate if it's an urgent case. Either way, whether it's written advice or a video meeting, you will receive an outcome document at the end of the process that includes the recommended advice. And it's then, of course, your decision whether and how to incorporate this advice into the clinical care of your patient. So if you've decided to have a video meeting, how does it work? If you want to join a meeting in CPMS, you just go to the meetings tab where you can see all of your upcoming meetings. And in the meeting details, you can see who has been invited, who has accepted the meeting invite. And at the time of the meeting, you can simply click join and you will be connected to the meeting room. The meeting can be recorded, and if it is, the recording will be accessible to you for 1 month. So if you need to refer back to what was discussed, you can do so. Just keep in mind it won't be available after 1 month. So that was for just the very basics of accessing and using CPMS. So I hope that you have a bit of a picture of how it looks like to use or to discuss your case in CPMS. It may seem like a lot of steps at first, but if you have any questions or encounter any issues during the process of using CPMS, you can, of course, always reach out to the CPMS help desks, and we're happy to help. I have a couple of additional slides, but I won't go into detail here. I think it's on the EU login and just our contact details, but I think the slides will be made available to you after the webinar, and you can check them.
Thank you so much for that, Greta. That was really, really helpful. So I do encourage any audience out there interested in perhaps using CPMS, if you have any questions, save them up to the end and we'll do our best to answer them. And now we have Vladimir. I won't try and say your surname, Vladimir, because I could make a dreadful mess of it. I do apologise. But he's very kindly going to give us a real life discussion, a real life example of how we can actually use CPMS across the ERNs for our patients.
Greetings to all webinar participants. On behalf of the team here at our Rare Disease Center in Khmelnytsky City Children's Hospital, I am pleased to share with you today our experience of cooperation with the ERN network. Introducing myself, I am Volodymyr Davydyuk, and I am a clinical geneticist and also a medical psychologist at our center. It is worth noting that Khmelnytsky City Children's Hospital, of which our center is part of, is by far the largest multi-specialty medical and diagnostic facility in the region, and so our priority is to take multidisciplinary approach to our patient treatment and diagnostics. Our center was established with the goal of providing timely diagnosis, ongoing medical support, and improving the quality of life of our children with such rare diseases. We strive to ensure that every child or even adult, regardless of the rarity of their condition, receives comprehensive high-quality care. Our specialty is on supporting children and adults diagnosed with spina bifida, Duchenne muscular dystrophy, spinal muscular atrophy, Wilson's disease, tuberous sclerosis, but we also provide support to patients with other rare diseases residing in our region. In modern-day conditions, the use of virtual tools for long-distance communication is of great importance for Ukrainian doctors, as it helps them work with the most vulnerable patients who are forced to deal not only with their own condition, but also with the difficulties brought on by the times of war. Such patients require additional attention and care, as they do not always have the opportunity to travel long distances to consult with specialists they can desperately need. Such challenges we face do inspire us to create a multidisciplinary team, which includes doctors of various specialties, including neurologists, geneticists, psychologists, rehab specialists, urologists, and many others who offer comprehensive support to our patients. And that is precisely why the opportunity to communicate directly with the ERN network has been extremely useful for us in ensuring that patients receive appropriate care and treatment. Our collaboration actually started with ERN in 2023 as part of a partnership, which included European Reference Network and Rare Malformation Syndromes, Intellectual and Other Neurodevelopmental Disorders, ERN-eUROGEN, the International Federation for Spina Bifida and Hydrocephalus, European Reference Network for Rare Malformation Syndromes and Rare Intellectual and Neurodevelopmental Disorders, and OmniNet Ukraine. As a result of our collaboration, a joint series of webinars between Ukraine and EU on spinal dystrophisms with international participation and certification have already been developed and implemented. Recorded sessions of this webinar are currently available for viewing at the ERN-eUROGEN website. Also, the start of a next webinar series, which will be beneficial for a wide range of Ukrainian and European specialists, has been already announced. Secondly, permissions have been granted to access and use Clinical Patient Management System, or CPMS 2.0, which allows for secure consultation on rare and difficult patient cases with experts from the ERN centers. The system is available via mobile app and web interface, and the platform ensures that data exchange in accordance with EU regulations. It enables clinicians to discuss patients and cases online regardless of their geographical location. Requests for opening discussion are processed through an established Ukrainian rare disease hub based on Ohmedit National Children's Specialized Hospital in Kiev. We are currently in active cooperation with the central hub. Communication is frequent and fruitful, and the process of submitting a case is straightforward enough. When our specialists need advice from the ERN, a request is formed. It includes key information about the clinical case, adhering to the principle of personal data security and confidentiality, and this request is sent to the hub. The hub in turn reviews the request and identifies a specific network whose specialists can be helpful in resolving the request, establishes contact with them, and allows us to open a discussion on the CPMS, where all the necessary materials on the case will be uploaded so that invited experts can review them before the discussion begins and add some comments if necessary. It should be pointed out and underlined specifically that it is a mandatory request to obtain a written consent of the patient or their representative in order to open the discussion at all. Advice given through the system may be considered so-called second opinion. It is a result of direct communication between specialists about a specific case, and it is used only as an auxiliary tool for the attending clinician to determine further tactics for treatment of this patient, a plan for observation, intervention, or further management. To date, we have held a series of discussions with ERN-eUROGEN specialists regarding patients with neurogenic bladder problems who require multidisciplinary approach. And it is good that there is a possibility to invite multiple experts from multiple fields for the discussion we had. During the virtual meetings, our team had a great opportunity to talk to colleagues, share practical experience, and receive valuable advice for managing these complex patients that required constant surveillance and support. If necessary, it is also possible to keep the discussion open and continue to return to it on this specific case after the initial consultation has been concluded. To review and discuss any possible updates, maybe to discuss new questions that arise in the process, and it is a really useful feature. And based on all that was said above, I see multiple advantages for Ukrainian doctors. And to name a few, we have direct access to European expertise. Through the Ukrainian hub, we can consult with top EU specialists on complex cases, enhancing diagnostics and treatment we currently provide. Also, there is a matter of efficiency and collaboration, as CPMS 2.0 features built-in video conferencing, chat, and streamlined case submission, which reduces delays, and in decision-making, it's really important. Also, I can say that CPMS is a really secure and compliant system which ensures GDPR compliance using end-to-end encryption for all data sharing and communication, which is critical for patient privacy. Also, I think this system has really user-friendly and simple and accessible user interface. It is really intuitive, easy to navigate. It also reduces the delays and difficulties that arise from slow connection and conversation. By using CPMS, we are also improving support for rare diseases, as it is specifically designed to handle the challenges of rare diseases, allowing for better tracking and management of this patient's care. And also, I should note that there is a really useful dedicated training session series for Ukrainian doctors that are available to assist with using the system more effectively. I think we can all agree that CPMS endorses greater collaboration between countries regarding the diagnosis and treatment of rare and complex conditions, increasing and spreading the knowledge, which results in improvements in quality of care and quality of life for these affected patients. Our team extends sincere gratitude to the Hub and our colleagues for their cooperation in access to CPMS 2.0. We look forward to continued active engagement as we had wonderful and valuable time using it by now, and we invite our Ukrainian colleagues to actively participate as well. I am thankful for your attention and for allowing me to present here today. Thank you very much.
Thank you very much, Vladimir. That was a fantastic example, I think, of somebody in the Ukraine, clinicians actually using CPMS. So we know it works. So please feel free to contact us with tricky cases. And then our final presentation in today's event, it's the most important one, really. It's the voice of our patients in rare diseases. And then it's an absolute honour and pleasure and technically great to have her here with us today, Tetiana Kulesha, and she's from the Orphan Diseases of Ukraine public organisation. So she's really very active in speaking up and being the voice of patients with rare diseases. So Tetiana, thank you so much for being here with us today. You're very welcome, and I give you the floor.
Okay, thank you, dear colleagues. And first of all, today, when I start my presentation, I want to say some words. After your presentation, I want to say some words about my team, which now work. Now we have very dark evening in Kyiv. I stay in Kyiv, and my team, it is the best team on the world. It is my colleagues. It's my colleagues Tetiana and our colleagues Volodya. He stay in office now, and I won't say that it is the best people in the world, because we stay in Kyiv, we stay in Ukrainian, and we try to help our patients during all day, during all our war. The second point, what I want to say a huge thank you our doctors who stay in Ukrainian and help our patients with rare disease, because it's a very difficult, I don't know how to explain, but it's very difficult to stay here and do their work. And third point, before my presentation, I want to say thank you, each of you, that you give chance to have second opinion or first opinion for Ukrainian patients with rare disease. It's very important for us. It's very need for us. And I believe that in the future, Ukraine was a part of European community, and it will be better to have the data between our doctors and doctors in Europe. Okay, I want to say some words about our organization, because we are the biggest organization in Ukraine. We was established on August 2014, and we support all patients with rare disease in Ukrainian. Now in our organization, we include 25 another organization from each regions of Ukraine. Yes, it's so difficult, but we work and stay and work every day from our patients. And if I say about me, I am mother of patients with MPS, and my son stay in Kyiv, and we have treatment in Kyiv, and we fight for our independence and fight for our life every day. And if we speak about organization, our organization, I need to say that we represent more than 20 nosologists and more than 2,000 of patients in our organization. And in this moment, we collaborate with all departments of our regions, with the Ministry of the Health, with all of our expertise of center in Ukraine. Now we have 27, and with each center of expertise, we have memorandum about working together. I think today we say a lot of voice, and the main voice of patients, why is very important and why it's needed, because we understand that in Ukraine is now very difficult situation when the war, and sometimes we cannot do the one voice of doctors, and sometimes we don't need the second voice. We need the first voice of doctors and first expertise. And when we have do it in Ukrainian, we need to do it abroad. We need to do it in your country. And now we say that nothing about us without us. It's not about patients with rare disease in Ukrainian, and it's about our voice in the world. We want that all Ukrainian voice will be heard in all the level of practice, all level of the expertise. Why difficult now context in Ukrainian? Why it's difficult in our country to have the good expertise for some cases? You understand that now a lot of our patients go abroad, but it's nearly 25%. But a lot of patients now have the moved for another regions in Ukrainian. And if we before the war have a lot of our center expertise of Sumy or Zaporizhia. It is cities which near the war now. Now these patients and doctors moved to another regions. By the way, we have the Center of Expertise with Orphan Disease in Zaporizhia. It is a very powerful center, but it's near the war, and our doctors from front line, yes. And now all the time work here, and a lot of patients take care with the doctors here. For you, okay, it's normal. For Ukrainian patients, it's very important to be involvement in all process in Ukraine now. In these photos, you see that our organization and my colleagues, we help our patients at home when they need go to the hospital. We do a lot of information, awareness about situation of orphan patients in Ukraine during the war. We take part in all community with our young patients and older patients. It is our step during the war. We establish a new line in our organization. It is line with younger patients with rare disease. And of course, the main point now, it is collaborate with the Ministry of the Health, and we take part, I think, in all group which take effort in orphan diseases. And I think we need to speak that all that doctors do, the European Commission do, the doctors in the European country do. The main point of this is patients. The patient is the center of all process. It is very important, and it's very important for Ukrainian patients too. ERN connect expertise and improve patients' outcomes. It's so important for us. Why the CPMS very need for patients in Ukrainian? Because it is a new system. It is more, I think, not more difficult, but it's more clearer for us, because if we have the one point of our doctors and one voice of our doctors, sometimes it's very important to patients have another point, or in our case of Ukrainian have one point, because we know that in Ukraine now we haven't enough of doctors which can give their diagnosis of our patients. Effective CPMS start with trust and communication with patients, with their family, and with the doctors. I think it is the line. This line we speak during all our webinars. Why this line important for all process, for all community, communicate for all patients and doctors? Because it's about patients. It's about care about patients. It's about help the patients and help the doctors and help their families. For us, it's very important now in this time in Ukrainian work together with our doctors, with Ministry of the Health, with our clinicians, with our families, because if we haven't collaboration, we haven't the result. And for Ukrainian patients, for our organization, it's very important. And I want to say one more thank you each of us, because it's very important now have this meeting. And when we have presentation, some doctors write to me and ask how we can do documents and how we can create the orphan center for some diseases. I don't speak about diseases, some diseases. It's very important really, because we built in a difficult time, we built the system of help for Ukrainian patients in Ukraine. I think that's all. I think we do more than we can. And I think we will have the collaboration with ERN and with the doctors in the clinics for all European center. And I believe in our victory that my team, and I believe that sometimes we will be in the European community. Thank you for your attention.
Thank you very much for that excellent presentation. I'm going to suggest that you stay here because I think we're going to move on to a Q&A session now. So we'll just have a look and see if we've got any questions that have come in from the audience. And I would like to invite perhaps our other speakers, if you can come into the webinar environment and join us, please, and then we can see who might be most appropriate to answer the questions. I've got a message of support. Thank you very much for our support. We are delighted to give it. We're happy to collaborate as much as possible. I've got a question here. Unfortunately, men aged 22 to 60 are prohibited from crossing the border due to martial law, even for internships abroad. Is there a possibility of cooperation between the ERN and the Ministry of Health in the Ukraine to help organise official business internships under the programme? Who would like to comment on that one first? Alberto, would you like to comment on that? And then I could probably chip in with something as well.
But I didn't follow the first part, so
Yes, well, I think the first part was about young men of working age, men 22 to 60 can't cross the border because of martial law. So they're wondering, is there some way of cooperation between the ERN and the Ministry of Health in the Ukraine to try and organise internships? I think we're a bit limited, aren't we, Alberta, at the moment by our current grant framework?
Yes, yeah.
So this is not something I think personally we couldn't help with this currently from our ERN because of course all the activities were described a couple of years ago when we wrote the grant proposals. So if people are prevented from leaving the country because of the situation with the war, I don't think we'd be able to help realistically with any kind of face-to-face training and education until after the situation was a little bit more stable. I don't know, what do you think, Alberto?
Yes, certainly. I think for now we have to engage that Ukrainian people are part of the network, but let's promote the engagement in all the on all the virtual activities, in the educational program, in anything else that can be attended virtually.
Thank you. I don't know, Yao, would you like to comment on that as well from the side of the European Commission?
Well, I certainly support what Alberto just said because, first of all, I'm not sure if the European Commission can do anything, let's say, in a reasonable amount of time. Because I still remember that to sign this simple agreement that we had for the use of CPMS, it took more than 1 year of discussion and so on. So to try to find a way out of this situation due to martial law, I guess it would be way more complex than this simple agreement. So even if we could reach some understanding, maybe it will be not in a question of months, but a question of years. So I don't think it's feasible to wait so long. So I think indeed what Alberto just said to promote everything that can be done online, it's maybe the most pragmatic approach to this limitation.
Yeah, which is already a lot, what we can
Yeah.
offer. And especially the webinar program, all the webinars are recorded. They can be seen at their own discretion whenever it is convenient for them. The clinical practice of the cross-border consultations show that the vast majority can obtain a good diagnostic and therapeutic advice without the need for physical traveling. So I think if they liaise structurally to the educational and patient care activities, that would be tremendous already, I would say.
Absolutely. Okay, if I look down here now, I think we've got one more question. It's from Oksana from the Ukrainian Pulmonary Hypertension Association. Since the beginning of the war, we've had practical experience of cooperation with the hub based at the National Children's Specialised Hospital, Okhmanj. Sorry about the pronunciation. In the first months of the war, this format became an effective tool for coordinating help, organising patient referrals, and communicating with international partners. Yes, I think it's very important that this initiative continues. I think we would all support initiatives like that. Although that isn't actually a question, I don't think, for any of the panel members. And someone is asking if we can provide step-by-step instructions for a healthcare professional on how to proceed with a difficult case. So yes, we absolutely can. If you download some of the presentations that were available in the webinar environment, you can find that. And please contact us via our websites and we can guide you how to contact the Ukrainian hub, etc. Any more questions? I can't see any more for the moment. Would you like to make some final comments, Alberto? I can't see any more questions. I think that's it for now.
Well, perhaps one that I can imagine that for certain physicians or patients, it might be difficult to assign themselves to a specific ERN. And one of the things that I have not which I did not present is the fact that certain conditions are ERN overarching. And if we look at Endo-ERN and EUROGEN, for instance, patients with rare urogenital conditions that need corrective surgery need a home in both ERNs, but it doesn't matter who they contact. So that we, as ERN coordinators and managers, we definitely align with each other to help the patient to seek the right entry into the hospital that he or she needs.
That's absolutely right.
Yeah.
Yes. Don't worry where you come. We are all in contact with each other and we collaborate.
Yes, I think that's an important message also for the Ukrainian colleagues.
I'll have one final peek at the questions. But I think that is a yes, that is it for today. So I think we can conclude today's webinar. I just want to really thank every single panel member so much for giving your time today and sharing your experience with us. And the key message is, please feel free to get in contact with us. We'd be delighted to hear from you and we'd do as much as we can to support our Ukrainian colleagues. Thank you.
Thank you all. Take good care.
Thank you. Thank you, colleagues. Thank you. We stay.
Thank you.
Yeah. Thank you.
Yes.
Thank
Goodbye.
you for your support.
And we stay with you.
Thanks a lot. Thank you.
Take care.
Thank you. If we will have question, we write it to you on site or email. Thanks a lot. Really.
Okay. Bye-bye.
Bye-bye.
Bye.
Bye.
Bye.